talk a little bit for me?
Hi, my name is Tyler with the City of Midland Health Department.
You need me to move over? No. All right, I'm ready when y'all are.
Ready. Ready to look down here? Let's start by saying and spelling your first and last name and stating your title.
Okay, my name is Tyler Collins, Tyler Collins. I'm the epidemiologist with the City of Midland Health Department.
And we're out here to talk about West Nile. What's going on?
We set out mosquito traps throughout the county in order to catch mosquitoes and then test them to see if they're carrying any diseases. So the summertime is typically when we start to see those pop up, not just here, but across the state, across the U.S. And we capture them, we send them to the State Health Department lab in Austin, and then they test them to see what type of diseases they're carrying. The purpose of that is so that we can inform providers and the public about what's circulating and what precautions to take to keep themselves safe.
All right, and could you describe that system a little bit more, like how many of these traps there are, how effective they are, and how many mosquitoes were picked up that happen to have West Nile? So
the way it works is we fill buckets with, we call it stinky water. It's basically fermented grass clippings. That attracts the female mosquitoes that are looking for a place to lay their eggs. And we have fans that will suck them up when they come to the water to lay their eggs. And then once they do, we capture them in these fans. And every time we've set out a trap, we have caught mosquitoes, regardless of whether, it's rained in the previous 3 months or it rained the previous day. These traps are very effective at catching mosquitoes, regardless of the weather conditions. And so right now we currently set out 4 traps. We kind of move them around as need be. We have a couple of more traps that we can set out if need be, but so far we're just setting out 4 traps total.
Do you know what area specifically in Midland those mosquitoes were positive?
Yeah, so the way that the surveillance works is because West Nile is carried by birds and then mosquitoes bite the birds and then bite people and pick it up along the way. Really, even though we detect it in specific locations, it's telling us more generally that it is in Midland County and not just localized to the locations where we have our traps. And so we don't really, say where exactly the traps are, mostly because it's not any more dangerous the places where we put the traps versus somewhere else. It's really just presence in the county that we're detecting.
And as of right now, there's only one confirmed case, right?
So the detections were in 2 of our mosquito traps. So basically, the mosquitoes that are in those traps are all tested together in what they call a mosquito pool, and that pool tested positive from 2 of our traps. So both of our traps, these were in different locations, tested positive for West Nile.
And you mentioned the rain earlier. Would you say that the rain that's been recently coming to the city and the county has been a primary factor in why West Nile may have come back to the Midland area?
Yeah, so with the rain, we definitely tend to see more mosquito activity. But last year was actually, a very dry year, but also a very bad year for West Nile. We're not exactly sure why that might be the case, because that was true across the United States and across Texas, not just across Midland. Whereas this year, we are obviously seeing more rain, but much lower levels of West Nile, both in mosquitoes and in humans to this point this year. So far in Midland, we haven't had no human cases that we've been made aware of. And so hopefully this year continues to be a pretty mild year for West Nile.
Right now, is there any major public concern as far as people being outside, anything like that?
No, I wouldn't say there's a major public concern. Mosquito bite prevention is pretty easy to do. It's things like dressing like I am, long sleeve and pants. Wearing bug spray is definitely, the biggest thing. If you can, limiting your activity to the times when mosquitoes are not active. So mosquitoes are most active at dawn and dusk. And so if you can, stay inside during those times. But really just wearing bug spray if you have to be outside is a good way to prevent it.
And who is the most susceptible to getting the Nile virus?
People that work outside, so if you're outside all day, you're sweating, it's hot, you put on bug spray, well, you might sweat it off. Or you might change clothes or something and then you want to reapply it. So it's kind of like sunscreen in that way, is that, periodically throughout the day, if you're working outside, you'll want to reapply.
If the virus is contracted by anybody, what are kind of the next steps that people need to take to make sure that they can get rid of it?
So if you get bit by a mosquito and then you start to show symptoms, so things like a fever, body aches, nausea, vomiting, definitely seek health care, talk to your doctor, and then see about getting tested for West Nile. You know, it may not be specifically West Nile. Mosquitoes carry other diseases, but West Nile is the most common one in the United States. And so if you get bit by a mosquito and then start to show symptoms, definitely seek medical care.
I know that it was also said that a lot of people don't usually show symptoms when they get bit. So kind of what will be the process then if somebody got bit but kind of don't really know?
Yeah, so 80% of people who have West Nile do not have any symptoms. They would never know that they had it unless they did antibody testing. So sometimes we see people who go to donate blood and their blood tests positive for West Nile antibodies, and they never even had any symptoms. And so for most people, 80%, it's not a problem at all. And then for those people that do get sick, 1 in 5 of those, those 20% that do get sick, most of those people just have, you know, pretty mild case, just the fever, the nausea, the vomiting, the body aches. It's only in a very small portion of the people that get infected that have the severe symptoms, but those can be very severe. You know, those can be things like paralysis, swelling of the brain and spinal cords, and possibly death. So, you know, for most people, you know, they will never even know that they had it, but if you do start to show symptoms, it's a good idea to seek medical care so that you can be, you know, evaluated by a doctor.
So you've gone over like recent outbreaks in the past. Can you describe what was the outcome of each of those? Like how many cases there were, possibly even fatal ones?
Yeah, so last year in Midland we had 3 total human cases, and one of those resulted in a death. The previous year, like I said, in 2023 was a mild year. We had no human cases. And then this year, so far, we've had no human cases. Last year across the state, I don't have the exact numbers, but it was a pretty severe year, you know, pretty frequent human activity, you know, human cases and deaths. And so hopefully this year, based off of the trend so far, it will continue to be a mild year.
Do you plan to collaborate with Midland Memorial Hospital in the future should this get any worse?
Yes, so we send the health alert, the notice that there was West Nile, to physicians. We send it to the hospital, let them know, you know, the symptoms that people presenting the hospital are likely to have, so that they can be aware of it, keep it in mind for the diagnosis for people presenting with those symptoms.
Awesome. Anything you want to add that we haven't touched on?
With all of the rain, you know, recently, definitely make sure to dump standing water. If you've got a bird bath, replace that water frequently. The stinkier and older the water is, the more likely it is to attract mosquitoes. We have seen mosquitoes in things as, you know, half an inch of water standing on a bucket lid. And so, you know, that's larva habitat. And so we definitely want to keep that standing water to a minimum.
Thank you.
All right, thank you so much.
All right, thank you all.
Grab my mic.
Yes.
Yeah. And I'll help you out with that.
Okay.
Oh,
Yeah, I'll just, if you can just unclip.
you wouldn't happen to speak Spanish?
No, I don't.
Okay, but leave this one for mine, so I'm gonna let it go.